morning. We're going to go ahead and get started. Welcome everyone to episode 2 of the Blend Win web series by HAR TREPAC, the Texas Real Estate Political Action Committee. I'm your host and the immediate past chairman of TREPAC at the state level, Deborah Spangler. As we continue to operate virtually, the HAR Political Affairs and TREPAC departments wanted to start this web series as a way to keep our members informed on Houston real estate politics and our recommended candidates from HAR leading up to the November election. If you missed our inaugural episode last month with State Representative Anna Eastman and State Senator Brandon Creighton, you can visit youtube.com/HARTV to watch the conversation. It was very informative and I think you'll really enjoy watching it. We'll post the link also in the chat section today. Throughout the series, we'll be bringing on elected officials that we've supported in the past, as well as political experts from around the state to give you a fresh perspective on what the Houston political scene is looking like leading up to the November election and beyond. So today's first guest is with us already, and he is a longtime friend of HAR and Houston Realtor members. So I want to just let Representative Harold Dutton of District 142 introduce himself. Tell us a little bit about his district and the area that it covers. So welcome, State Representative Harold Dutton.
Well, thank you very much. Thank you for this opportunity. I want to say thanks to HAR and everybody at the Realtors Association for all the help they've been to me in this campaign. You know, this campaign is cranked up. We've got lots of volunteers. Unfortunately, this COVID-19 thing has changed a lot of things. And so instead of knocking on doors, I told somebody we went back to old school way. That means we look at campaign contributions based on how many stamps it'll buy. So that's how we communicate with everybody now. But I want to thank you all very much. Let me say, I came to the legislature in 1985. As a result of prodding by two of my great friends who are both deceased now, Mickey Leland, who was the congressman at the time, and El Franco Lee, who had been the state representative just as Mickey did and was running for the county commissioner's seat. They thought it'd be a great idea. I had spent 18 years by that time with Conoco in the corporate planning section, and so it had kind of lived and traveled all over the world for Conoco. And I never thought that I would actually run for elected office, although I had helped lots of elected officials all over the country doing one thing or another, and certainly had been active in my district, been chairman of one of our hospital boards and started junior achievement here and came to work at one of our local nonprofits in the community. And so I decided that, okay, I'll do it. I'll do it for one term. And you all need to go and find somebody else to do this because I'm going to go back to work for Conoco because I took a leave of absence initially to come and do this. And when I came to the legislature, like so many people, it sort of, it sort of bites into you. To the point where you want to do some good. It's a community that I grew up in. It starts here just north of downtown Houston and kind of goes all the way, it starts at 5th Ward and goes all the way out east on one side of Interstate 10, all the way out to Barrett Station, all the way out to the county line. So it's pretty expansive geographically. And yet this is like I said, this is a community that I grew up in. I started off, when I first ran for election, I had to tell people, they said, oh yeah, we remember you. You were the paper boy. And I said, yeah, but you got to remember my name because my name is on the ballot. The paper boy is not going to be on there. And so they said, oh, okay, we'll do it. And anyway, I got elected that first time. And I've been there since 1985. I'm number 3 in seniority now. I tell people the story that when I first came, I was one of the absolute diehard opponents of seniority. but I've since changed my mind.
Yeah,
uh,
it'll do that to you, won't it?
yeah, it does. Yeah. And so I'm looking forward to going back. I feel good about this campaign. And I thank the people in my district for giving me this chance and this opportunity, because it's been one that's actually been enlightening. I have enjoyed serving the people in the district. As I said last night at a forum I had, being a state representative really involves two things. One, what you do in Austin, and which is only for 140 days, as you all know. And then the other part is what you do in the district. And we've had one of the most responsive district offices for that entire time. And I've certainly enjoyed what we do in Austin. This time coming up in Austin, things are going to be quite different than they ever have been in the history of Texas, because we're looking at how to combat and have a session in light of all of the health consequences that are around. It has affected Texas's budget to the point where I think all the state agencies have been asked initially to lower their cost by about 5%, 10% in some cases. And so there's going to be a time when this time it's going to be a lot of less resources because Texas sales tax collections are down. The oil industry has taken a hit. And so all that portends some rather downward postures for looking at the state budget. That's the only bill we have to pass during the legislature, is the appropriations bill. The Constitution requires us to pass that. And so it is going to be a difficult session, but I think it's one that's going to require all of us to come together who are like mind to really get together and solve the problem for Texans. And so I'm looking forward to doing that. And again, I thank you all very much.
Absolutely. Well, thank you. And I wanted to go ahead and start with our question. So you have 36 years of experience. And how do you think that that will help you when it comes to working with that limited budget this session?
Well, again, experience counts. Just like elections matter, experience counts. I don't know of any job where experience doesn't matter, that a person walking in will have as much knowledge 35 years later as they did when they first came onto the job. If that's the case, then you're probably not doing much of a job. It's not much of a job if you can do that. And in this case, what happens more often than not in the legislature is things happen because of personal reasons, because of personal relationships. And in 35 years, I've built the kind of relationship with people in the legislature that really, that affords me the opportunity to be in the mix, so to speak, as far as them. Last session, after last session, I was really fortunate that the Texas Municipal League made me their Legislative of the Year award because they recognized the things that I had done during the legislative session. And again, like I said, you don't do anything by yourself in the legislature. You actually, sometimes we take credit and act like it's by yourself, but that doesn't happen. You need 76 votes in the House. You need a majority in the Senate to get things passed. And that more often than not is dependent on your personal relationship, or can be. I remember years ago when I had a bill on the House side, and it went to the Senate, and this is back when Ann Richards was governor, and it was a bill that assisted women and minority-owned businesses, and it got passed. And Ann Richards called me up, and she said, "Harold, how in the heck did you get this bill passed?" And I said, well, Ike Henderson and Donnie Henderson, who were on the other side of the aisle for me, who were Republicans, decided that they would carry the bill in the Senate, and it got passed. And that's how I did it. And so that's why I think experience matters, because you have an opportunity to develop those relationships. And certainly that's 90% of getting things done in the legislature.
Right, right. And we appreciate you using that to serve our community, that experience. You're also a member of the House Committee on Public Education. And the question I think that's keeping a lot of Texas parents up at night is, what is the current likelihood of our students returning to the classroom in the fall, and what changes will need to be implemented to make that happen, and both at the state and the local level?
Well, we're going through kind of trying to decide that at the moment. My philosophy is I think we need to let this COVID-19 dictate what happens, to the extent that it is still out of control, which in Houston, one of the largest Harris County, the largest county in Texas, it is almost beyond its limits in terms of how people are responding to it. If that keeps up, I don't see how a parent in good faith can send their child to school. Children catch all kinds of diseases and things at school. And it's not so much that as it is, even that's bad, but not so much that, but they bring them home. And one of the things we know about this pandemic and this disease is it's quite prevalent in terms of attaching itself to people. And so I think the science has to dictate what we do in terms of children going back to school. I would love to have the children go back to school. That's the premise I think we all work under. But we only want to do that under certain circumstances where we protect the health and safety of the children and certainly the parents of those children.
Great, thank you. We understand that, and I know the teachers are also very concerned at this point as well.
Absolutely.
Now, you are chairman of the committee that is Juvenile Justice and Family Issues. And so how do you see the pandemic affecting the families who are now at home all the time, more than they probably ever have been with their children? What kind of things are you seeing happening with families in your district?
Well, one of the upsides to all of this is the fact that we've had to go back to doing things kind of the old-fashioned way. Families are now at home more often together. They're having to learn to do things together. I was talking to one of my colleagues' daughter yesterday, and she was saying how bored she was. And I said, you know what? I said, you know, she's, I think, 10. And I said, you know, do you want to take a vacation? And she said, yeah. And I said, you know, one of the best ways to take a vacation is get a book and go somewhere in the book. She said, what do you mean? I said, well, I remember when I was in school, we used to come back every summer. After every summer, we'd have to talk about, and perhaps you did too, we'd have to talk about what we did that summer. Well, all I'd ever done was go to Louisiana and work on a farm. And I was so bored with that I decided I would go to the library, and I got a book about Australia. And I wrote that I had gone to Australia and I've had all these things about Australia. And everybody was looking at me in the class like, Harold, we know you didn't go to Australia. And I finally told the teacher that I did go to Australia because I went to it in the library. And I got this book on Australia, and I read all about Australia and everything that happens in Australia. And everybody fell out laughing. but it is the best way to take a vacation. And I think if there's any good upside to this virus, it's been that families have now been closer together. Now, in some cases, that's created stress on the family, stress on the individual in the family. And that's not been very good sometimes. But I think overall, what it's done is brought us a lot closer together and back toward the things that make a difference in a family.
Absolutely. Well, thank you. Yeah, absolutely. Those kids didn't grow up with the 3 channels that we had on TV.
Yes, right.
They don't know.
Right.
They don't know
Well, that's like my granddaughter last night at dinner. She started talking to me about Netflix. I said, I don't have Netflix. And she said, Grandpa, you don't have Netflix? I said, no, and I don't want it either.
Well, thank you so much. I know that we have run out of time for questions, but we so appreciate your perspective. We appreciate your experience and sharing it with us. And is there anything you'd like to leave us with? Any
Well,
last?
well, thank you again. I just want to say from the bottom of my heart, thanks to all of the realtors all over the state of Texas and to your organization. Thank you for the help that you've been to this campaign. It's certainly warmed my heart. And in times like these, things sometimes get a little stressful and difficult, but it's been delightful to have the support of the Realtors Association. And I'm looking forward to working with you all so that we can improve things, not only for the state of Texas generally, but for realtors specifically.
Wonderful. Thank you so much. We appreciate you. And we
Thank
hope to
you.
see you soon again. Thank you.
Thank you. Thank you again.
You're welcome.
Stay safe.
You too. Careful.
All right.
All right, so that was great information. And we have one more guest. I want to take a moment to remind everyone that early voting ends tomorrow. So if you haven't had an opportunity to go out and vote, please do so. The actual election day is Tuesday, the 14th, but who knows, what could happen. It could be 120 degrees, or, we could have killer hornets, or something could happen. So be sure and take the opportunity to early vote tomorrow, just in case. So our next guest is another great friend of HAR and our members and the community that she serves. Representative Sarah Davis of District 134 is joining us this morning. I'm so happy to have you here. Hi there. We are honored to have you. We want you to kind of tell us a little bit about yourself and your district, where your district is, and kind of give us a district update, if you please, before we start with our questions.
Sure. Well, thank you for having me. I'm Sarah Davis, of course, a state representative here in Houston, and I represent House District 134, which is essentially the west side of Houston, almost entirely inside the loop. But I do go, of course, outside the loop because I have all of Bel Air, and I have some other neighborhoods in the north that go outside the loop. But very much of an urban district. I have the honor of representing the world's largest medical complex, which is the Texas Medical Center, and Rice University, of course, is in my backyard. And I have the cities of Westview, Southside Place, Bel Air, and then of course parts of Houston. If we weren't in a pandemic, I would be bragging that our district has the best shopping and the best restaurants, but a lot of those things are put on hold. I live here in the museum district, so obviously we have wonderful museums, but it's just, it's a really wonderful place to be in Houston, and with the medical center here, obviously we're we're really in the thick of it, dealing with the pandemic. I'm in my 5th term, so that's a lot actually. I was first elected in 2010, so my first legislative session was in 2011, and pretty much throughout those 10 years, my legislative focus has been largely on healthcare. I made the leap to run for office about 4 or 5 months after my last treatment for cancer. I was a young breast cancer survivor diagnosed at the age of 32. I'm now 44 and, remaining cancer-free, so that's good. Yes, thank you. But I really have been focused almost entirely on healthcare issues. I spent my first part of the legislature in public health, and then kind of the last 3 sessions have been more on the money side. I still do a lot of policy work, but my focus in the last 3 sessions has been on the budget, because I am the chair of the subcommittee on appropriations for health and human services, which is a lot to say, but that's basically the healthcare budget for the state. And it's about $85 billion with a B. So it is, it would be the largest portion of the budget. It's second to public education. And it's second to public education because of all of the investments that we made in public education last session. But healthcare is certainly the fastest growing sector of the state budget. And then in addition to being the chair, for the last 3 sessions, I've been the budget conferee for Article 2 for Health and Human Services. And so that's an interesting process, but in a nutshell, the House will pass a budget and the Senate will pass a budget, and they never match. The chambers, you know, have their own priorities. I would maintain that the House budget is always better than the Senate budget.
I'll quote you on that.
Yes, I'm biased, but like any bill, they have to be identical before they can go to the governor's desk. And so when there's a conflict, a conference committee is created, and that is done when the lieutenant governor chooses 5 senators and the Speaker of the House chooses 5 representatives. And then the 10 of us, you know, confer and we hammer out the details of the budget. And so when we're doing it for the budget, you know, it's me versus my Senate counterpart. And last session, it was Senator Kolkhorst. The 2 sessions before that, it was Dr. Schwartner. And so basically the 2 of us sit in a room off campus where no one can find us. So no one can lobby us. And so we can, you know, really just sit and focus and try and iron out all the details so we can get to a document that is identical and that both of our chambers will then adopt. So that's what I spend most of my time during session on is hammering out that budget.
Well, it sounds like you have a couple of things on your plate for sure. Wanted to ask you, you know, you have been known as one of the most consistent members of the House to be able to work across party lines. And, you know, you came and visited with HAR recently with one of our committees, and there were people from both sides, there were officials from both sides. And, you know, to see you all working together and the camaraderie, it was just really inspiring to us as we, you know, because you hear so much bipartisan and this side, that side. And, you know, I wanted to go to lunch with you guys and, you know, and have a margarita because it was, y'all were awesome together. And so how do you see that as going to be able to happen, especially with all of the stuff that's going on right now? I think there's a lot of people taking sides on issues. So how do you see going into this next session, being able to continue to have that relationship?
Well, I think that's always been the legacy in the House is that, you know, we try to work together. There are always going to be a handful of sort of hot button partisan issues that will divide the chamber by party lines. And I don't toe those party lines on some of those votes, especially dealing with, you know, women's right to choose and being an ally of the GLBT community. That the Republican Party generally is not receptive to those ideas. But, you know, at the end of the day, 90% or more of what we do, we do it with unanimous votes. And there's a whole lot of trust that takes place in the chamber because we're only there for 140 days. And so we have, you know, a very limited amount of time, and none of us are experts on everything. So we all have to trust each other. You know, we trust that Dan Huberty knows, you know, he's a leader on public education. So if we have questions or if Dan Huberty is proposing something, we trust, you know, what Dan is saying. If I'm speaking about managed care organizations, you know, the body's going to trust that I've done the work and that I'm speaking. And you know, trust is the most important thing. Like if any member feels like they're trying to be tricked by another member, or the body feels like it's trying to be tricked by a member, you know, that's going to be sort of the death knell for that member. But at any given day on the floor, you know, we don't take lunch breaks, we don't take dinner breaks. So we have to just, we eat in shifts, and you rely on your desk mate and the people around you. And there's a little room called the members lounge right off the floor. And it has about 4 or 5 tables and 4 or 5 chairs around each table. And you know, anytime around, you know, lunch or dinner, you can walk in there and you're going to see 20 or 25 members all crowded together. And we're basically all sharing what we have. Like somebody may have pizza, somebody has, you know, Greek food. And, you know, there's something to be said about just breaking bread, you know, just sitting down. We're not on the debate floor. We're at a table and we're just eating, and we're talking about our families, what's going on. You know, we're not talking about a fight we may have just had. And so also when you're that dynamic of being locked basically in a room for 140 days, you feel like family, and you're going to fight, you know, like brothers and sisters fight. But at the same time, with some exceptions, of course, there are some members that are not that way. But for the most part, you know, we all want to be supportive of each other because we all understand that our jobs are the same, which is to represent our constituents. And so we want to try and help each other. I remember my first term, Miss T, Symphonia Thompson, we call her Miss T. You know, she called me over to her desk and she had a sheet that she wanted me to sign to be a joint author of one of her bills. And all I knew was that Miss T was a Democrat, you know, and I had just unseated an incumbent Democrat. And so I'm thinking this is a trick. You know, I don't know, you know, because I've never, you know, I've just been campaign mode for a year. And then you get there and there's no training, by the way. We don't get any kind of training when we get here. You spend your first year just trying to figure out how to get to the floor and to your desk and to your office. And so I remember thinking, oh my gosh, this is a trick. And I looked over at her desk mate, Doc Anderson, who is a Republican, and he always has a cowboy hat, and he just kind of tipped his cowboy hat, you know, and gave me a nod and a wink. And so I just said, okay, yes, ma'am. And I signed it. And then I ran over, you know, to my office or to my desk, and I called my office and I said, what is HB, whatever the bill was? And they said, oh, that's the Major Human Trafficking Initiative for the session. And it was at that moment that I realized the campaign ends, you know, in November, and governing begins in January. And most members understand that. Some members never get it, but the members that do get it, it changes everything. And it just becomes a situation where we really want to see each other succeed, no matter, you know, what your political party is.
That's wonderful. That's great to hear. It really, you know, looking on the outside in, we don't always see that. You know, we don't see that secret room where everybody's a big family. So thank you for sharing that. Have to throw in a COVID question. So your district, the medical center, the Texas Medical Center, is in your district. What do you see, or what information can you share with us about the current hospital situation? And we hear so much about ICU capacity on different news reports. What are you seeing from your district there?
Well, you know, I speak weekly with various hospital and TMC administrators. I will say that there are sources of information that I go to every day, which would be the TMC website, and also the Department of State Services website. They have pretty good dashboards. I preferred, to be honest with you, the TMC dashboard before maybe it's alleged that Governor Abbott was unhappy with the numbers that he was seeing, and so they made some changes, and so the dashboard, I think, is a little bit more confusing. But we are essentially according to the TMC numbers, you know, we are hovering each day. It changes a little bit, but we are essentially at 100% capacity at our ICU. Now, it doesn't mean we don't have surge capacity, which they're now calling phase 2 capacity and phase 3 capacity. So we have plenty of surge capacity. So I was looking at the numbers for today, Harris County is reporting 39,300, I'm sorry, Department of State Health Services is reporting 39,311 positive cases in Harris County. Now the TMC dashboard says that there are 53,300 positive cases, but it's important to remember that the TMC dashboard is including not just Harris County, but the 8 or other surrounding counties. So they're looking at a broader, not just Harris County. But when you look at ICU bed capacity, I mean, today we are actually in what they're calling phase 2, which is we are in surge capacity. We have occupied 100% of normal ICU beds, and that is 1,364. Now, 615 of those ICU beds are for COVID patients. But every day changes. We can go down, 1 or 2 beds and up 1 or 2 beds. We seem to just be hovering around 98 to 103% capacity, depending on the day. And while I think that's an extremely important measure to be watching, people should not, I do not feel comfortable, and I would not feel comfortable spreading the message that there's an ICU bed available for everyone, because we don't want to be in an ICU bed.
No, I don't want to be in one.
Right, we want to watch these numbers, but to me, what I'm looking at is the positivity rate. And the positivity rate right now is like 15%. And at one point in Houston, days ago, it was reported at 25%. So this is what's dangerous. This is what is evident to me, and I'm not a doctor or an epidemiologist, but to me, this is uncontrolled community spread. And that's what scares me. It's not so much the ICU capacity, it's what are we doing to stop this spread? And the most important thing we can do, obviously, is stay home, avoid crowds, good hygiene, and always, always, always wear a mask, when you leave the house. I know that they're uncomfortable and they look silly, but I mean, I do not walk out of this house without a mask on. And my, interactions in the public are severely limited to, grocery store, pharmacy, just things, essential things that I have to do to survive, but not attending political functions like a convention, or not even hosting in-person political functions, because I just don't think it's safe. So I'm just paying attention mostly to the positivity. I think that our local, like our mayor and our county judge, I think they're doing a good job. I think that they should be allowed to exercise the same authority that they were from the very beginning. Because this positivity rate and this community spread is really outpacing our ability to do the contact tracing and then the containment of the people that are testing positive, because it's just so widespread. So right now, I think the best thing we can do, again, is just wear a mask. But I think that our leaders are doing everything that they can. I mean, nobody wants to see their constituencies sick. And this concept of people seem to think it's like you either have no symptoms or you're in the ICU and then you die or you recover. And that's not really true. I mean, people that recover still have very long-lasting, health issues, lung damages, liver damages. So, it's not like the flu where you may just get sick and feel bad and then you get over it. And I think that there's not enough attention being drawn to what exactly does it mean to be recovered from COVID? And how does that going to affect your long term? And some of it we just don't know because it's such a new, a novel virus. But I don't think people should find comfort in the fact that we have enough hospital beds. I think people need to do everything that we can to avoid those hospital beds.
Absolutely. Good. That's good advice. And I know the same thing. I don't want to be there. And I don't care if you have 1,000 beds. I don't want to be there.
Exactly.
But, well, we have run out of time, and we appreciate so much you being here with us and your service. I know you've been 10 years now, and we look forward to another 10 years perhaps. And we're fighting for you. Thank you for fighting for us and for being there and keeping that door open for both sides and working so well for both parties. We really appreciate you.
Well, thank you. You know, I always say it's my job to represent all of my constituents, not just Republicans. You know, I want, when my bills pass, I want my bills to have Republican and Democrat support. When I come home, I want Republicans and Democrats to be proud of what I've done. To me, that's what makes a good leader, is being able to build consensus and have people and have everyone, or as many as you can, buy in to your policy decisions. So I'm so grateful that HAR has always been so supportive. We are going to have a very, very tough race in November. We're one of the #1 targeted seats. So your support is just so important. It always has been, and I value it a great, great deal.
Oh, well, thank you. You're very welcome. And thank you again for being with us.
I'm happy to be here, at least virtually.
Yay! Yes, it's, you know, could be worse. We could not see that face and get to
I mean, I get, it's an excuse to take a shower, you know, and put makeup on.
Yeah. Thank you. All right, viewers, that wraps another episode. Thank you. Another episode of our blend, and we look forward to having you again for our next episode. Thank you so much for being there. Have a great and safe week.